There are new warnings today about overcrowding in Quebec's hospitals. Doctors are now calling the situation out of control, and they want to see officials take action before things get even worse. Marianne Domaine is on the story, and when I say how bad and out of control, how dire are things? Do we have a measure?
Well, we know that looking at the numbers, so many emergency departments in Quebec operating well over 100%. Doctors there saying the situation is deteriorating and, as you mentioned, out of control. So how does it get back in control? They are looking for more accountability from the province and health officials. I'll get more into that in just a moment. But when it comes to exactly what patients and doctors are dealing with in hospitals across Quebec, we're talking overcrowded waiting rooms, long wait times, excuse me, staff also trying to figure out places to treat these patients in the first place. We know that emergency department heads actually have written a letter to the health ministry in Quebec asking them to do more to help the situation. This is something that they say has been going on for months, and things are only getting worse. We know that not only is there the long wait times for the patients, we also know that the staff is overworked. Those who are there are getting burnt out, and so this is just the beginning when it comes to the problems that staff are dealing with. Here's more on just what they can see day to day.
Waiting room for ambulatory care is usually overwhelmed right now because a lot of people with viruses. But the problem is also with the patient waiting a room upstairs. So patient that needs a stretcher, that needs to have a full workup or have IVs and medication. These patients are waiting right now in the emergency rooms because most of the places, the hospital is full, so there's no place to put those people.
And we've been taking a look at the numbers this morning in the hospitals across Quebec. And part of the numbers, not only how many people are waiting in the waiting rooms, but also the occupancy rates when it comes to stretchers. But looking at the number of people waiting in ERs right now, 635 across Quebec. We also know that another option is to call 811. That is for those who are dealing with minor ailments, but you can see the wait time is quite long there. So just to give you a snapshot of what people are dealing with right now, Heather, but over the weekend, things were also bad. So many people waiting in emergency rooms, as I mentioned, well over 100% capacity.
It's certainly not the first time we've talked about problems in hospitals, but I was struck by the big headline on an analysis piece in the Montreal Gazette this morning that it is worse than ever. So what are doctors saying has to be done then?
Yeah, this is an unprecedented situation. We know that many doctors over the course of the pandemic, even Heather, have been ringing alarm bells about the situation there, that things are very dire. Here we are now years later, and again, the messaging is the same. We also know at the end of November, 2 patients actually died while in a waiting room on Montreal's North Shore. That is something that is still investigated, but really highlighting this renewed message for more accountability, also for patients to do their role. A lot of people go to the emergency room for minor ailments, but that isn't always the solution. Here's more on that.
People know that they have a minor condition, then they can call 811 to be directed. They can look online. They can help us by looking online and finding clinics, asking their pharmacists, or trying to solve their situation rather than to come to the emergency.
So 811, as we saw on that board this morning, that wait time more than an hour. In the meantime, the Ministry of Health, Heather, saying they'll look into the situation, go to hospitals, speak to staff, and that's what they're hoping will make a difference this time around.
All right. Thank you very much, Marianne Domaine, on the story for us in studio this morning.